Welcome everyone. Today I'm going to talk about the temporomandibular joint examination. Temporomandibular joint, familiarly called as TMJ, is a joint between temporal bone and the mandible. TMJ is capable of combination of both hinge and the gliding movements. Hence, it is also called as a ganglion-arthroidal joint. Ganglion meaning hinge-like movement, arthroidal meaning gliding movement. For examination of the TMJ, we should know few things. TMJ is located about 1.5 centimeter anterior to the tragus of the ear. Now moving to functional anatomy. Mandibular movements are achieved by the combination of a muscular activity along with the rotation and the translation of the TMJ. Opening movement is by lateral contraction of the lateral pterygoid muscle, and closing movement is by the bilateral contraction of the masseter muscle. Protrusive movement is by simultaneous bilateral contraction of a masseter and lateral pterygoid, temporalis, and medial pterygoid. Protrusive movement is by the bilateral contraction of inferior bellies of the pterygoid. Retrusive movement is accompanied by temporalis and suprahyoid muscle. Lateral excursion of the mandible are brought about by the lateral pterygoids by the opposite side of the temporalis, which assists the movement. Here, you can see the 3D visualization of the skull in the different views. The first one is the masseter muscle. The second fan-shaped large muscle is the temporalis. And this one has the medial pterygoid. And the final one is the lateral pterygoid. Now let's go to the examination part. Examination of the TMJ includes the 3 parts of a TMJ proper, examining the muscles of mastication and examining the accessory muscles. Under examination of TMJ proper, it is done by 3 basic headings. One is the inspection, palpation, and auscultation. Under inspection, we have to inspect for any facial asymmetry, check for any swellings or ulceration in the preauricular region, observe for any deviation or deflection of the mandible on the mouth opening. If the mandibular midline moves to one side in the initial stage of the mouth opening and return back to the original position, the maximal mouth opening is called as deviation. While if the mandibular midline fails to return to the original position at the maximal mouth opening, it is called as a deflection. Now moving on to the palpation. Condyles are palpated by the intraauricular and extraauricular methods. Coming to the intraauricular palpation. The little finger is placed inside the external auditory meatus during the mandibular movements. Condylar movements are felt with the help of the pulp of the little finger. In extraauricular palpation, the condyles are palpated in the preauricular region, about 1.5 centimeter medial to the tragus of the ear. Joint noises and pain might be the responses while palpating. So while mouth opening or during the intermediate opening or during the mouth closing. While palpating, we have to palpate for the tenderness of the TMJ during the restricted position, right and left excursion, protrusion and retrusion, and also check for the hypermobility and mouth opening. Now to auscultate the TMJ. For auscultating, the bell end of the stethoscope is placed medial to the tragus of the ear. Most commonly heard join sounds or clicking sounds, popping sounds, and crepitus. So this bell side of the stethoscope has to be placed. Now moving on to examination of muscles of mastication. So muscles which helps in the mastication or chewing is called as a masticatory muscles. So now let's begin with the temporalis. Temporalis is palpated simultaneously with the fingertips aligned in the row from the hairline just above the supraorbital ridge and above the ear. The patient is asked to report any symptoms of a pain or tenderness. Masseter. Masseter is palpated bilaterally in the area overlying the anterior border of the mandibular ramus. The muscle mass and the bulk of the masseter is also felt, and the patient's response has to be recorded. Now moving to pterygoid. Pterygoid muscles manual palpation is difficult because of the inaccessibility of the muscle. For the medial pterygoid, it can be palpated by placement of the index finger laterally and posteriorly into the floor of the mouth towards the medial surface of the angle of the mandible. For the lateral pterygoid, the index finger is positioned distal and posterior to the maxillary tuberosity, and posterior pressure is exerted to compress the tissue against the muscle. So now moving on to examination of the accessory muscles. Digastric muscles are palpated with the fingertips aligned roughly parallel to the inferior border of the mandible in the submental and the submandibular region. Cervical examination. Under cervical examination, we check for the mobility of the neck and examine for the range of the symptoms. The patient has to be asked to look to the right and to the left side, and then should be at least a 70-degree rotation in the each direction has to be observed. Now the patient is asked to look upward as far as possible and then downward. Then the response of the patient has to be recorded. For sternocleidomastoid muscle, palpation is done bilaterally on the outer surface of the mastoid fossa behind the ear. The entire length of the muscle is palpated down the origin near the clavicle. The fourth one is the posterior cervical muscles. In palpating these muscles, the examiner's fingers should slip behind the patient's head, and those of the right hand palpate the right occipital area, and the left hand should palpate the left occipital area. The fingers then move down the length of the neck muscles through the cervical area, and any patient discomfort has to be recorded. And this is about the examination of the accessory muscles. So that's all for the TMJ examination. Thank you.